afternoon and welcome to the American Society for Microbiology's annual meeting, ASM Microbe, from Boston, Massachusetts. My name is Aliyah Khan and I'm the media manager for ASM. This press conference will focus on research related to the ongoing monitoring of Legionella in Flint, Michigan in the wake of the drinking water crisis. This research was performed by the Flint Water Study team at Virginia Tech and will be discussed by Drs. Amy Pruden and Otto Schwacke, who are from the Department of Civil and Environmental Engineering at Virginia Tech. I'll hand this over to Dr. Pruden first. Thank you for joining us today.
Okay. Hi, so we're here at the ASM Microbe meeting in Boston representing the Flint Water Study team. And we presented a poster yesterday entitled Lapse in Municipal Water Corrosion Control Linked to Elevated Legionella in Buildings. And I'm Amy Pruden. I'm a professor at Virginia Tech, and I'm a co-principal investigator on a National Science Foundation Rapid Award, which is led by Professor Mark Edwards at Virginia Tech. And the idea for this project originated about a year ago when Mark first learned about the massive corrosion problem in the Flint water distribution system. And I think most are aware that that led to leaching of lead into the drinking water and unfortunately elevated blood lead levels in children. Now at that time, Mark and I were working with several students in trying to understand the factors that trigger Legionella proliferation in building, and we were working on some projects related to this. And we hypothesized that the deteriorated water quality in Flint, Michigan could well stimulate Legionella to grow, and that we would find elevated levels in tap water. And it turns out that a few months later, it was in fact announced that there was a significant uptick in Legionnaires' disease in Flint, Michigan during the time that the Flint River water was used as their municipal water source. And so what we're presenting here at ASM Microbe is some of our ongoing monitoring data. So we monitored Legionella using molecular methods back in the fall when the system was still on the Flint River water. And then we were able to go back in March of 2016 after about 4 months of switching back to the Detroit water supply, implementing appropriate corrosion control, and we're comparing how those numbers are changing with time. And this is work that is been led by Otto Schwacke, who's a postdoc at Virginia Tech, and also co-led by Emily Garner, who's a PhD student at Virginia Tech, and we've had assistance from Owen Strom, who's a master's student. And so with that, I'll hand it over to Otto, and he'll provide you with some information about the details of the study.
All right, I want to start off with a little bit of background information, starting with Legionnaire's disease. So this is a deadly form of pneumonia, and now in America and in most developed countries, it is the leading cause of drinking water-related outbreaks. So it's estimated that at least 18,000 people in America are affected by this disease. That has about a 9% mortality rate. That's very high for a waterborne disease. Legionellosis, disease caused by Legionella, comes in two forms mainly. Legionnaire's disease, the pneumonia that hopefully you've all heard about, and Pontiac fever, a lesser form that's more like a flu. Both are caused by bacteria of the Legionella genus, particularly Legionella pneumophila, the species, and one strain of Legionella pneumophila, serogroup 1. Now, what makes these bacteria sort of special when it comes to comparisons to other waterborne pathogens is that they are built to live in water. Unlike, say, Salmonella, that's built to live in our guts, Legionella do well in drinking water, especially in engineered systems, particularly when heat is involved. They love heat, hence why cooling towers are a very commonly implicated source of transmission for Legionnaire's disease. Now, there are two primary ways that Legionnaires can be transmitted. Respiration, we all might have heard of this. Legionella get into the air in aerosols, we breathe them into our lungs, we get pneumonia. A second form that's less commonly known and not so well understood is aspiration. or during the act of physically drinking water, it goes down the wrong pipe and ends up in our lungs. It's actually a relatively common way that all pneumonias are transmitted. So, like Amy had said, in 2015, we submitted a rapid grant to the National Science Foundation to determine if the water quality, the lowered water quality in Flint, could be associated with increased Legionella numbers in buildings. We had a working hypothesis, and some key points of it were that the corrosion would leach iron from the plumbing in the city and in buildings. Legionella love iron, they need it to grow. And importantly, the corrosion would decay chlorine that normally does a relatively good job at keeping Legionella numbers down. So in August, like Amy had said, in August and October of 2015 and in March, we collected tap water samples from both small and large buildings to assess the levels of Legionella that we could see there. Now, before I get into the fine points about this study, there are sort of two key points I want to clarify. First, there's a sort of misconception about what we have been trying to do in Flint. Our goal is not to say the Flint River caused these outbreaks. I don't know if that will ever be possible. And it's more that we are trying to take advantage of this unique opportunity of this corrosion-related crisis in the drinking water system to learn how changes in municipal water supply and treatment can impact Legionella at a sort of community level. And number two, I'd like to point out that this is a large ongoing project, and what we talk about today is just a small snapshot of the whole picture. So getting into the methods, for our sampling of Legionella in Flint, like I said, we collected tap water from hand-washing sink faucets in small single-story homes and businesses and large multi-story hospitals and one office building. We also looked at buildings in areas surrounding Flint, including Flint Township, a community adjacent to Flint, very similar infrastructure, but importantly, they remained on Detroit water the entire time and were never supplied by Flint River water, so sort of a negative control there. We wanted to look at hot and cold water, so for every outlet we sampled, we collected 2 water samples, a first flush of cold, basically went to the tap, turned the cold on, collected it. Then we turned the hot line on, let it run for 60 seconds, and collected a post-flush sample of hot water. On site, we looked at temperature and pH, and back in our lab, we performed metal concentration analysis. For our microbiological assays, we looked at the DNA of Legionella and the specific species we're concerned with, Legionella pneumophila, and we also attempted to cultivate Legionella. So in March, we added this cultivation step, very important in that it allows us to confirm the presence of live, healthy, viable, potentially pathogenic Legionella, and allows us to collect isolates that you can do all sorts of interesting work with, especially comparing to clinical isolates that were cropping up in the old outbreaks and in the future. So first, I'll go over the data for our qPCR. For large buildings, particularly one hospital that we were able to repeat, concentration and number of positive hits for Legionella, again, DNA, decreased between fall and March. And while the total numbers we saw and the maximum numbers were lower than the, no other way to put it, extreme numbers we saw occasionally in the fall, these concentrations were still relatively high compared to other similar studies across the country. And importantly, a large portion of outlets in this one building, 90% almost, were still positive for Legionella. For small buildings, the story was a little different. While the percentage of positive samples decreased substantially, the average concentrations were very similar. So when we look over all these results, we kind of have this idea going forward that the improved water quality that we and other groups are seeing in Flint has played a role in reducing the Legionella numbers, with the caveat that, again, Legionella like hot temperatures. In March, where it's still snowing in Flint, the tap water, especially the cold line, is still cold, and that could have impacted our numbers. So it'll be very critical to continue monitoring the system going forward into the hot months. Now, talking about our cultivation results. So basically, we determined the presence of live Legionella in the system, including Legionella pneumophila in both small and large buildings we looked at. By adding cultivation in addition to PCR, we also increased our detection rate substantially. It's an important point. So now what we have is a library of 120 environmental isolates. I believe more than all their sources from Flint combined. So what we can do with these is perform characterization and, like I said, hopefully compare to some other isolates. One sort of experiment we are in the process of running through is looking at these isolates and trying to detect the presence of genes that are linked to pathogenic forms of Legionella, including Legionella pneumophila, that causes about 90% of Legionnaires' disease, a strain of Legionella pneumophila known as serogroup 1 that is responsible for about 85% of Legionella pneumophila infections, and Legionella pneumophila serogroup 1, a more specific strain known as monoclonal antibody group 2 positive strain that is seen in about 94% of outbreaks, so increasingly pathogenic strains. So far, we've observed Legionella pneumophila in a large portion, about half of our samples from both large and small buildings, and we are detecting serogroup 1 and monoclonal antibody group 2 Legionella, but in lower proportions, and most have been collected from one hospital we sampled from. So we also looked at the physiochemistry of water to determine links between water quality and Legionella. Between fall 2015 and March this year, we have seen noticeable large shifts in the overall concentrations of metals in both large and small buildings throughout the city of Flint. It's pretty clear that it's a different water going through, and it's treated better than it was back in the fall. There are 4 metals we want to focus on in our study going forward that are linked either positively or negatively to Legionella. Iron, manganese, and zinc have all been shown to have a beneficial effect to these bacteria. Now, these levels all went down between fall and March. Copper is commonly associated with antibacterial properties, also has an antagonistic effect against Legionella. Concentrations of copper actually went up. So looking at these pictures, it really does look like, at least in regards to some metals, the water in Flint is less conducive for Legionella than it was before. Now looking at temperatures, not surprisingly, cold temperature values were lower in the winter as they were from the fall. But hot temperatures across the board were very similar, not surprising as water is regulated by water heaters. Unfortunately, both in fall and in March, in large and small buildings, pretty much everywhere we looked, hot water temperatures throughout the city tended to be ideal for Legionella, basically incubator temperature. So when we combined these physical results with our microbial data, we really believe that the situation has improved from the fall. So regardless of this, because we detected Legionella, including pathogenic strains, there's some level of risk for Legionnaires' disease in Flint still. So we are strongly urging public health officials, medical professionals, and even citizens in Flint to be aware of risks and remain vigilant when it comes to Legionnaires. Particularly, we are suggesting citizens who have pneumonia or symptoms of pneumonia to see a doctor and suggest they receive a test for Legionnaires. Now, our work in Flint isn't finished. In addition to another sampling, sort of broad sampling, like similar to the ones I discussed here, we will be conducting in August. This week, I believe, we are beginning a more focused study looking specifically at homes and water heaters in homes. We're trying to determine if flushing of water heaters can sort of help to remediate Legionella, or if replacing water heaters might be an option. And as a sort of closing statement, I'd like to just reaffirm that these set of outbreaks that occurred in the 2014-2015 summer in Flint, when you look at them, different ways to measure outbreaks, but regardless of how you break it down, they comprise one of the largest clusters of Legionnaires' disease in American history. 91 cases, 12 deaths. Death-wise, I believe that's number 3 in American history. The same number of deaths that happened in the more publicized Bronx outbreak last summer. So this was a major issue, and we, I believe, need to be cautious going forward because another outbreak like this would be very devastating. So with that, we're finished and would like to open the floor up to any questions. Sure.
Hi, I'm Jared Gallagher with Infectious Disease News. I talked to you yesterday. Just to follow up on what you just said, why do you think it's difficult to get people to pay attention to this or to be interested in it? Not a lot of people are talking about it, and not a lot of people are covering it.
Do you want to fill this one? Get both opinions.
Well, I think Legionnaire's disease is more complex than lead poisoning. Lead, we've known, is toxic since the time of the Romans, it's pretty straightforward. All of the risk models have been done. But with Legionnaire's disease, it's more complex. There aren't that many documented examples where we know a switch in municipal water supply triggered Legionella. And the fact that it grows in buildings, but yet it's the water supply that triggered it. And then just the bottom line that it was not monitored in the water supply during the time that Flint River water was used, and isolates were not obtained, and very few were obtained from patients, and they were not compared to be able to conclusively confirm a link between the switch in the water sources. And so I think that's part of the reason it's just more complex. But it is important to bring attention to this issue, as in terms of waterborne disease, Legionnaire's disease is actually the #1 source of waterborne disease outbreak in the U.S. at this point. And
Drinking water.
In drinking water. And as Dr. Schwake talked about, there is an opportunity to learn here and hopefully not only help Flint, but also to help other communities prevent similar outbreak.
Amy really hit the nail on the head, but specifically in Flint, I think there might be some sort of social influence. So the lead story really blew up, both from media and social media. So I think it really sort of is overshadowing. There was coverage of the Legionnaires, but it was after and during these big lead crisis. I also believe that, I've heard this theory, I don't know if I sort of subscribe to it so much, but there's a stigma to both diseases. Lead poisoning happens in children. Generally speaking, people really care about children, right? Legionnaires, it's thought to be mostly occurring in older people. So when you have young lives at risk versus people who've lived a happy life, I think at least subconsciously people will be more concerned with one than the other. And that might be playing a role.
Hi, Ed Sussman with MedPage Today. Again, we talked yesterday, and I just wanted to ask again, the Detroit water from, I guess, Lake Huron has now been in use in Flint for about 6 months or longer. How safe is the Flint drinking water now?
So we know its safety in regards to lead pretty well. It's being extensively monitored and tested and studied by a number of government and private and research agencies, including ourselves. So as of April, I believe our statement was, don't drink lead water, don't drink Flint water, use a filter, you can bathe in it, and there's specific precautions based on age, how else you can use it. As far as Legionnaire's risk, we don't know. Without a broad sampling, without more testing, and also kind of taking into the fact that, like Amy had said, Legionella is complicated. We don't understand, especially when it comes to associating detection to risk. So a non-zero risk exists. Is it higher than in other cities? Possibly. Is it a major concern like it was in previous years? Probably not.
And for sure, with respect to lead, we know that's still an issue. You do not want to drink the water without a filter. Now, the National Sanitation Foundation certified filters are very effective for removing lead, and so if you put that at the point of use where you're collecting your water for drinking, that should be fine. There's still been a lot of questions about rashes, and I've heard from people personally who swear that they're having issues with bathing in Flint water. If you're such an individual, that's a personal choice, but in terms of any scientific measures, we don't have anything that we can point at that should be a problem for bathing, and certainly not lead. It should not be an issue for bathing.
How long do you think it will take before you can say the water is safe to drink without any qualifications?
We'll have to continue to monitor, and unfortunately it has taken a little bit longer than initially hoped for. And part of that is because people have lost trust and they're afraid to turn on the tap, and the system really was not flushed at the level that a normal drinking water system would be. And so the freshly treated Detroit water with the orthophosphate corrosion control chemicals added has not been delivered at the rate that you would typically expect. So it has been slower, and we'll just have to wait and see.
And sort of related, all drinking water has a risk for Legionnaires, right? The water in this building has Legionella in it if we looked hard enough. So safe to drink, safe to use. It's all relative. Flint will never eradicate Legionella. It'll meet federal standards for lead. There are no standards for Legionella federal. Some states do, but not Michigan. So whether it'll be safe enough in regards to Legionella, it's going to take sort of outside research to kind of get a better bearing on that.
I think that's all the questions we have today. Thank you so much, Drs. Pruden and Schwacke. That was a great conversation. If any of you watching have any additional questions, please email them to us at communications@asmusa.org, and we can forward your questions on to the researchers. Thank you so much for watching.
Once you're in the BSL-4 space, the only way you can get out is to go through a chemical shower.
It's an unusual room, never seen anything like this.
Anybody who has access to this facility first has to go through an R scan.
So the HEPA filters filter the air coming out of the facility, and that will remove bacteria, viruses, anything that might constitute any kind of risk, right?
Remember, this building is basically a second building inside the main building.